Hi, I'm Dr. David Yao, an attending urologist here at UCLA. This webinar today will talk about hematuria, which is just a fancy word for blood in the urine. Hematuria is one of the most common reasons why adult men and women see a urologist. This topic is particularly important to me because over the last 10 to 15 years, I've noticed a lot of my patients having gone to see Dr. Google or Dr. YouTube before seeing me. While I encourage my patients to do research online and to talk to other doctors, I have found that there is a lot of misinformation out there. So the goal of this webinar is to go straight to the facts for blood in the urine, really go over what you really need to know about this, and I hope by the end of this webinar that this will be a helpful experience. Blood in the urine, or hematuria, comes from the Greek word for blood, hema, and the Latin word for urine, urea. Gross hematuria means blood in the urine that is visible to the naked eye. This picture is of gross hematuria. It looks like a dark red. Blood in the urine can also appear bright red or dark brown. This means that there is a lot of blood in the urine. Microhematuria is blood in the urine that is not visible to the naked eye or invisible. Microhematuria has to be evaluated and found by laboratory tests, such as a urine analysis. That's the use of a chemical stick to look for a chemical reaction to find blood in the urine. The confirmatory test for microhematuria is something called urine microscopy. That's simply someone looking under the microscope and actually counting how many red blood cells are in the urine. I want to start with a review of the anatomy of the urinary tract because blood in the urine can come from any of these organs. So here we see someone who has two kidneys. Each kidney is connected by a long tube called the ureter to the bladder. So the upper urinary tract, two kidneys, two ureters. The lower urinary tract, one bladder, and the urethra is what drains out of the bladder. Men also have an extra organ called the prostate. The prostate is located just under the bladder and surrounds the upper part of the urethra. So again, blood in the urine can come from any of these organs. And this cartoon will be a useful diagram to refer to as we look at X-rays, ultrasounds, CAT scans in the next few slides. I really want to emphasize the good news, and this is very important. When people get news that they have blood in the urine, it can be very scary. But the truth is that most of the time, something benign, something that is not serious, is the cause of blood in the urine. I'm going to go over some of the most common benign causes, the non-serious, non-cancer causes that can result in blood in the urine. One of the most common is a urinary tract infection, or UTI. The picture here is of a growth plate that shows urine that has been put on the growth plate and then examined 48 hours later. For people who have a urinary tract infection, bacteria will grow, and that's what this picture shows. People who have blood in the urine will often also have other symptoms, such as burning with urination, increased urgency and frequency that is much worse than normal, bladder pain, and possibly fever and chills. If someone has a urinary tract infection, almost all the time, this is cleared with a simple course of antibiotics. This is not a big deal. An enlarged prostate is another common cause for blood in the urine. This typically happens in older men. The picture on the left is a side view of the male lower urinary tract. You'll see that the prostate here, right under the bladder, is normal sized. There's an open channel for urine to pass through. Now, when someone has an enlarged prostate, as pictured here, you see that the prostate is kinking off the urethra, making it hard for the bladder to empty. Now, if someone has an enlarged prostate and they have no symptoms and no repercussions from the enlarged prostate, such as bladder stones or urinary infection, this does not need to be treated. But if the large prostate is causing obstructive urinary symptoms, such as weak stream, hesitancy, or problems like urinary infections and bladder stones, then this will be treated with either medications or surgeries. And there is a plethora of surgical interventions that can be done for this to minimize the size of the prostate, such as TURP, TURP, Urolift, Resume, HOLEP, HOLEP, and robotic prostatectomy. A kidney stone is another common benign reason for blood in the urine. Here is a plain film X-ray showing a kidney stone. Now, things on an X-ray that are dense, like stones or bones, are going to appear white, and things like air are going to appear black. So this is an X-ray, we call it a KUB, for kidneys, ureter, and bladder. And we see the spine here, and that red arrow is pointing to a stone in the left kidney. Now, kidney stones, if they're small and aren't causing any symptoms or problems like recurrent urinary tract infections, are often simply observed, maybe followed with imaging once a year or every few years. If the stone is very large or is causing a problem like recurrent urinary infections, then we will use surgery to treat it. Surgeries for this include ESWL, lithotripsy, ureteroscopy with laser lithotripsy, and PCNL. Stones in the ureter can also cause blood in the urine. This is a picture from an ultrasound of a patient who has a ureter stone. On an ultrasound, hard things like stones are again going to appear white, and in an ultrasound, liquid appears black. So here is an outline of the kidney, which is gray, and the inside of the kidney, here, the renal pelvis, has urine in it, and that's why it appears black. At the beginning of the ureter is this white stone, and that's the ureteral stone. Now, with ureteral stones, unfortunately, if you have this, you're probably going to know it. This causes one of the worst pains in someone's life. People typically find themselves in the emergency room. The good news is the pain itself is not a sign of anything else bad going on. People recover from this very well. In fact, most ureteral stones are small enough that people can pass it on their own. Sometimes these ureteral stones are really big, or the stone doesn't pass on its own. And if that happens after at least a few weeks, then we'll do surgery to go after the stone, either using ESWL or ureteroscopy with laser lithotripsy. A bladder stone can also cause blood in the urine. Here is a CT image, a cross-section of the pelvis that shows a bladder stone. A CT scan is basically a fancy X-ray. So again, air is going to appear black, and things that are really dense are going to be white. The lining here is of the bladder, which is gray. Inside is more of a dark gray because that's urine. And air here is in the GI tract, which is why it's black. The red arrow points to the bladder stone. This is a pretty good sized stone. This shape is called a jackstone. And here's a picture of a jackstone in real life. A stone this big typically will cause symptoms, and it's just too big to pass. So we'll do surgery to remove this. It's a very small surgery called laser cystolitholepaxy. If the stone's very small, we typically will let patients pass it on their own. Now, stones in the urinary tract comes really in all sorts of different shapes and sizes. And so here are some other pictures of stones that come from the urinary tract. Vigorous exercise can also cause blood in the urine. One of the most common forms of exercise that causes hematuria is running a long distance. That's called runner's hematuria. A common treatment for this is to ask the runner to drink fluids 30 minutes before they run and not to empty their bladder before they run. The idea is that the urine provides a buffer so that when the runner is running, the bladder is not rubbing against itself, causing friction and blood in the urine. Other common causes for blood in the urine that are benign include menstruation, prostate infection, medical kidney disease, kidney trauma, and certain medications, such as those used for joint swelling and certain types of pain medication. So why do we treat blood in the urine seriously? Even though most of the time it's due to a benign cause, it can be an early warning sign of a urinary tract cancer. That is a cancer of the kidneys, ureters, and bladder. And if we find these cancers early, this can be life-saving. So please, know that if you have a cancer of the urinary tract, there is a very high cure rate when found early, and do not ignore blood in the urine. If you see it, please come and see a doctor. We'll now go over some of the more common malignant or cancer reasons for blood in the urine. The first is bladder cancer. The upper picture is a CT scan showing bladder cancer. The red arrow points to a filling defect, and that filling defect that appears black here is a papillary bladder cancer. Papillary just means something that grows out. The lower picture is an endoscopic picture. That means that a fiber optic camera is put into the bladder and we looked at the inner lining of the bladder. The tumor is shown here by the red circle. If you zoom in, you'll see that this particular patient also has several other small papillary bladder tumors just to the left of the dominant tumor shown here. When bladder cancers are found early, it can be treated with a very small surgery called TURBT. It's basically a shaving of the bladder, and this can often be curative when found early. If bladder cancer is more aggressive or has had time to become more aggressive, then we may have to remove the entire bladder. That's called a cystectomy, and that's a much bigger deal. We want to try to avoid that. This is a coronal image of a CT scan of the kidneys showing kidney cancer, because kidney cancer can also cause blood in the urine. Just for orientation, this here is the spleen, this is the liver, here's the right kidney, and here's the left kidney. Most kidney cancers are found when they're very small, and kidney cancers are one of the less aggressive cancers. So we now know from research done over the last 20 years that small kidney cancers are safe to be observed. However, if this cancer appears to have characteristics that are suspicious for aggression, for example, it grows very fast, or the tumor is very large when first found, then treatment is recommended. Something called partial nephrectomy. Our surgical techniques have improved quite a bit in the last 15 years for kidney cancer, such that most of the time, even with really big kidney tumors, we're able to save much of the normal kidney. And that's great, because that means that patient has extra kidney reserve, and at the same time, they're often cured of the kidney cancer. The tumor here is shown in that red circle. A more uncommon but aggressive urinary tract cancer is a cancer of the inner linings of the upper urinary tract, that is, of the kidneys and ureter. The picture here is an endoscopic picture where we look at the inside of a ureter, and the red circle has a tumor in the middle of it. When these tumors are found early, we can use a laser to vaporize the tumor. But if the tumor is bigger or looks like it's invasive, then we have to remove the entire kidney and the ureter. That's called a radical nephroureterectomy. So if someone does have blood in the urine, we really want to evaluate that because of some of the urinary tract cancers that we just reviewed. When blood is found in the urine, the job of your doctor is to make sure that there is not something more serious causing it. Again, I want to emphasize that urinary tract cancers are not the most common reason for blood in the urine. However, if it's not found early, that can be a real problem. If you have a urinary tract tumor, please take a deep breath in, deep breath out, and then give a call to a urologist, preferably a top urologist who specializes in these tumors. Most patients with urological cancers tend to do well. Now, when you first see a doctor for blood in the urine, you can expect them to ask you some questions about your medical history, such as smoking history, family history of urinary tract cancers. A physical exam will be performed, and often blood and urine samples will be taken for laboratory testing. The doctor is trying to find the most common causes of blood in the urine, again, benign causes, such as UTIs or kidney stones. And if a benign cause is found, and after treatment the blood in the urine goes away, no further testing is necessary. However, if a benign cause for blood in the urine is not identified, then we have to try to figure out how likely it is that someone who has blood in the urine has a urinary tract cancer. The main risk factors for a urinary tract cancer in someone who has blood in the urine are gender, age, smoking status, and degree of hematuria. Men and advanced age are risk factors for a urinary tract cancer. The more someone has smoked in their life, the more chance the blood in the urine is from a urinary tract cancer. The good news is, if people stop smoking, after a year, the risk of a urinary tract cancer starts to go down. And the longer they stop smoking, the more and more that risk goes down. And degree of hematuria. The more blood that is present, for example, gross hematuria, is more likely to be associated with cancers of the urinary tract than microhematuria. Additional risk factors for urinary tract cancers include irritative urinary symptoms, such as burning with urination. Certain chemotherapies can also cause increased risk of urinary tract cancer. This includes cyclophosphamide, which is used to treat breast cancer, ovarian cancer, lymphoma, and leukemias. Ifosfamide, which is a chemotherapy used to treat lung cancers, lymphomas. If there is a family history of urothelial carcinoma or genetic syndromes such as Lynch syndrome, these are increased risk factors for having a urinary tract cancer. Certain occupations where there are exposures to chemicals called aromatic amines can increase the risk of a urinary tract cancer. These jobs include dry cleaners, hairdressers, oil workers, truck drivers, and a history of a chronic catheter in the bladder. Typically, these are for people who are not able to empty their bladder. If they've had a catheter for many, many years, their risk of developing a urinary tract cancer goes up. Let's remember this list of additional risk factors, because I'll refer to it again later on when we talk about risk stratification. So depending on your risk of having urinary tract cancers, you may be advised to get an ultrasound of the kidneys, a CT scan of the abdomen and pelvis, and or a cystoscopy. An ultrasound or a CT scan are imaging modalities primarily to look at the upper urinary tract, the kidneys and the ureter. The main difference between the ultrasound and the CAT scan is that a CAT scan is able to find smaller abnormalities in the kidneys and ureters that an ultrasound would miss. The lower urinary tract is evaluated by cystoscopy. A cystoscopy is the use of a fiber optic camera, a small one, to look inside the lower urinary tract. We're really trying to take a look at the bladder, but we also look at the urethra along the way. When people hear about cystoscopy, people are often nervous about it. The truth is, cystoscopy is very quick. It takes 2 to 3 minutes to do. It's highly tolerable and has a very low risk of complications. I've done a cystoscopy on over 5,000 individuals, and almost every person has told me the experience of the cystoscopy was much better than they had imagined. Doctors use guidelines to identify risk categorization to determine what kind of testing is needed for each person. So people who are at low risk can avoid a lot of testing. People at high risk will need in-depth testing. Patients who have blood in the urine and are considered low risk are defined as having all of these characteristics. Young age, so a woman under the age of 50 or a man under the age of 40. A low exposure to smoking, either a never smoker or less than 10 pack-year smoking history in their lifetime. A small amount of blood in the urine, that is 3 to 10 red blood cells per high power field under the microscope. And also not having any of the additional risk factors that we reviewed on slide 20. For patients at low risk of urinary tract cancer, the doctor will have a conversation going over the benefits and the drawbacks of testing. Most of the time, people will elect to simply repeat a urine test within 6 months. If the blood in the urine is gone at the repeat test, then no further workup is needed. However, if blood in the urine is still present, then an ultrasound of the kidneys and a cystoscopy is recommended. For patients who are interested in a workup at initial diagnosis, a kidney ultrasound and cystoscopy will also be recommended. People who are at intermediate risk are people who have any of the following factors. Women aged 50 to 59, men aged 40 to 59, a relatively low smoking history, 10 to 30 pack years, a medium amount of blood, 11 to 25 red blood cells per high power field, persistent microhematuria, that means that blood in the urine is seen on more than one occasion, and if they have one or more of the additional risk factors we talked about on slide 20. People who have intermediate risk for urinary tract cancers would be recommended to undergo a kidney ultrasound and a cystoscopy. People who are at high risk are anyone who have any of the following conditions: age 60 or higher, a greater than 30 pack year smoking history, a large amount of blood in the urine, that is more than 25 red blood cells per high power field under the microscope, and if there was visible blood in the urine. People at high risk for urinary tract cancers are strongly recommended to undergo a CT scan and a cystoscopy. We've gone over a lot of information about blood in the urine today, but I really want to emphasize a few important points that I hope you'll take home. First, most patients with hematuria do not have a life-threatening problem. It's typically from a benign cause. So don't be too nervous if you have blood in the urine. But be nervous enough that you seek evaluation, because sometimes there is a serious condition causing it. The good news, if we find it early, people do very, very well. So please, do not ignore blood in the urine. If you or someone you love has blood in their urine, please come and see a doctor, your primary care doctor or a urologist. If you're interested in learning more about blood in the urine, I strongly recommend the website for the American Urology Association. If you're interested in learning more about some of the disease processes that can cause blood in the urine that we touched upon today, such as an enlarged prostate, kidney stones, bladder cancer, and kidney cancer, several of my colleagues here at UCLA have made some outstanding webinars, and I encourage you to take a look at it. They're available here at this website. If you or a loved one has blood in the urine and you wish to be evaluated at UCLA, please give us a call at 310-794-7700. We offer in-person visits as well as telehealth video visits. So whether you're in Los Angeles, in California, in the United States, or anywhere in the world, we can help you here at UCLA. I'm Dr. David Yao, an attending urologist here at UCLA. Thanks for watching.